So let's talk about why you should avoid drinking while you're eating if you had weight loss surgery.
3, 2, 1.
Here we go!
Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to another episode of our FAQ section. And boy, is it a frequently asked question when somebody gets weight loss surgery, somebody gets a gastric sleeve procedure, and they ask the doctors, they ask their teams, they ask themselves, why should I avoid drinking while I'm eating? Why is a doctor telling me to avoid drinking while I sit down and eat? Why is that? And to be honest, while I was in training many years ago, I would hear my professors tell the patients, don't drink while you're eating and wait some 30, 45 minutes before you sit down to eat. And once you finish eating, wait another 30 to 45 minutes to start drinking again. And I really struggled until I understood this and what I'm about to show you and demonstrate to you. And it has a lot of sense once you see this, all right? So that's why I'm here today to explain why you should avoid or stop drinking before you start eating, at least some 30 minutes, ideally some 45 minutes before you eat. And then you can restart drinking after you eat. Again, I suggest you wait at least 30 minutes, ideally 45 minutes. So no drinking 45 minutes before, and no drinking 45 minutes after you start eating, all right? And let me demonstrate to you why. So I'm going to demonstrate to you the reason why. And I just need you to understand that this right here, if you had a sleeve where you had a gastric bypass, this would mimic your sleeve, this long narrow tube, like in the gastric sleeve, or this can mimic your gastric bypass pouch right here, all right? So it is important for you to understand that when you chew food, and it pretty much goes down the esophagus with this consistency, all right? This is some mashed potatoes, pretty much some, I want to say almost liquefied potatoes here. But it serves a purpose. So I want you to see how it goes down the esophagus, goes to your stomach, in this case your sleeve or your gastric bypass pouch. Notice how it's slowly going through and passing to the bottom part would be like your intestine, all right? So it goes from your sleeve to your intestine, but notice the rate. Notice how much time it takes for the food to be in your pouch, to be processed, and then pass to your intestine. This is really good time for your sleeve, your stomach to distend, to digest, and give your body time to send that signal to your brain to tell you, all right, I am full, you can stop eating now. So that is why, because we give it time, because the food is filling your sleeve or filling your gastric bypass pouch. But what happens, and remember, this is without drinking. We have not, we stopped drinking before and we are waiting. But what happens if you say, oh, I think this is all just BS, I'm just gonna drink. I mean, I really don't think it has nothing to do. And you start drinking while you're eating. And I'm gonna mimic a tiny sip of water, all right? Notice the rate, notice the rate. You take another sip of water. It's more. You drink more, it's more. It's more. Faster, faster. Voila. That is the reason we tell you don't drink at least some 30, 45 minutes before you sit down to eat. Because otherwise, you lose the compression of the stomach, you lose the filling of the stomach, you lose that time frame that you want your stomach to signal your brain to tell you to stop eating. If you're drinking while you're eating, pretty much tells you that you're going to be eating more overall calories a day because you're flushing your food down your pouch, your sleeve, or in this case, your gastric bypass pouch. Easy to comprehend. Believe me, until I saw this, it was mind-blowing. It was, now I would understand my professors. Now I would adopt that rule, that guideline that I would tell my patients. And I am here just to tell you, try to avoid drinking while you're eating if you had weight loss surgery. Is it a must? Can I drink because I really like to drink? Well, yeah. I mean, if you tolerate drinking while you're eating and you wanted to go ahead and do so, yes. But I'm here to demonstrate to you that you will be consuming more calories because you get hungry again, and guess what? You start eating again because you have not received that signal that you are full, and then you drink again and you flush it down, and it goes on and on. Notice that your sleeve is empty, that it did work for you, it did fill up, but you're flushing your food down to your intestine. All right, so there you have it. I hope this makes sense. I hope this is so eye-opening for you as it was for me at that moment in my life. But if you follow your doctor's guidelines, and this is just one guideline, we have many that we give out to our patients. It is for your own good. I hope you found this useful, and if it was, if you can give me one of these, I would really appreciate it. It helps us a lot here on our YouTube algorithm. And don't forget to subscribe for future YouTube videos. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.